The broadcast is now
Oh,
starting. All attendees are in listen-only mode.
good morning, everyone. Thank you for joining a few minutes early. We'll get started at 10:30. I didn't mean to hit the start broadcast button, but I did. So welcome a little early, and we'll get started at 10:30. Hey, Sandra, can we do a quick mic check? Hey, Sandra, can you hear us?
Sonny, can you hear me?
Yes, we can. Thank you.
Okay, yeah, I got out and then came back in.
Perfect. Thank you for checking.
Okay, thank you.
Thank you. All right, well, good morning, everyone. It's 10:30, so we're going to go ahead and get started with today's Webinar Wednesdays presentation. We're happy to have you all here with us this morning. My name is Sunny Lawless, and I am the Assistant Program Director and Volunteer Coordinator for our SMP programs. I'll be your host this morning. And presenting for us today is going to be Sandra Coburn, who is a community outreach specialist here in Louisiana, and Danielle Guillory, who is our Mississippi team lead and community outreach specialist in Mississippi. So today for the April installment of Webinar Wednesdays with SMP, we're going to talk about genetic testing, fraud, and scams. During the presentation, you're welcome to type any questions that you might have into the chat, but we are going to hold those until the end of the presentation when we open it up for Q&A. And there will be a prize drawing at the end of today's presentation. For those of you who were registered to attend by 10:15 this morning, your names have been entered onto a prize wheel, and we will spin for a prize of a $25 Amazon e-gift card. And you do have to be present to win. Before we get started, I do need to let you know that this project is supported by the Administration for Community Living, Department of Health and Human Services as part of a financial assistance award with 100% of our funding by ACL and HHS. The contents are those of the authors and do not necessarily represent the official views of, nor are they an endorsement by ACL, HHS, or the U.S. government. And if this is your first time joining us, we want to give you a little information on the Senior Medicare Patrol Program. SMPs are grant-funded projects, as I just mentioned, of the Department of Health and Human Services and the Administration for Community Living. All SMP grantees have a shared national identity through a national program name and logo. Every state has its own SMP program. In Georgia, Louisiana, Mississippi, and Vermont, SMP is sponsored by AdviseWell. And our mission is to empower and assist Medicare beneficiaries, their families, and caregivers to prevent, detect, and report healthcare fraud, errors, and abuse. And we do that through outreach, counseling, and education. Now, before I kick things off to Sandra, who's going to talk to us more about what genetic testing is and how fraud can occur, I do have a quick polling question for you. And so today's question is have you ever been asked if you wanted a genetic test to screen for cancer or heart disease? So let's go ahead and we'll launch that poll for you all. Yes or no? Have you ever been asked if you wanted a genetic testing to screen for cancer or heart disease? We'll give everyone just a few moments to respond. Okay, just a few more seconds. Lock in those answers. All right, I'm going to go ahead and close the poll and share the results. So it looks like about 18% of you say yes, you have received those types of phone calls where they've offered to do genetic testing or heart disease screening, and 82% said no. So we're going to go ahead and let's get back to our screen here. There we go. So now I'm going to turn things over to Sandra, and she's going to start us off with talking about genetic testing and how fraud may occur with this type of testing. Sandra?
Thank you, Sonny. Good morning, everybody. The Center for Disease Control describes genetic testing as a series of different tests that can provide information about various genetic disorders or your potential risk to develop certain types of cancer. The sample may be taken in several different ways: cheek swab, blood sample, or spit sample. Next, please. Genetic testing fraud and scams are one of the biggest issues facing Medicare beneficiaries. The scammers are offering these tests for free to Medicare beneficiaries. They then bill Medicare for tests that are not medically necessary, and in most cases, the beneficiary or their personal physician will never receive any results. Genetic tests should only be ordered by your personal healthcare professional when he or she deems it necessary. Next. There are many different types of genetic screenings and tests. Cancer screening, DNA screening, and hereditary cancer screening are just a few examples. Remember, genetic tests should only be ordered by your personal healthcare professional when he or she deems it necessary. Next. Here are some examples of genetic testing fraud. The scammers may come to your local senior center, senior apartment complex, or senior health fair event that you are attending. They may ask you questions about your family or personal health care, such as, has anyone in your family had cancer? Have you had cancer? They will then offer to perform a genetic test that they claim will tell you your chances of developing cancer. Next. One of the latest growing genetic test fraud trends focuses on cardiovascular genetic testing. We have heard reports of scammers calling Medicare beneficiaries, claiming their cardiologist or provider wants them to have this test and offering to send a kit. In reality, their provider did not make such a request. Next. The following are some examples of cardiovascular genetic testing fraud. A company offering you free or at no cost to you testing without a treating physician's order and then billing Medicare. A company using telemedicine to offer testing to you over the phone and arranging for an unrelated physician or teledoc to order the test. Billing Medicare usually thousands of dollars for a broad range of cardiac genetic tests that you did not request or possibly even receive. A company calls you stating your doctor or cardiologist requested that you have the testing done, and they will send you a testing kit. Next. Now we're going to take a look at when are genetic tests generally covered by Medicare. When someone has stage 3 or 4 cancer. When the test is medically reasonable and necessary. Federal regulations define medical necessity as services or items reasonable and necessary for the diagnosis or treatment of illness or injury or to improve the functioning of a malformed body member. When it's ordered by a treating physician, federal regulations define a treating physician as a physician who furnishes a consultation or treats a beneficiary for a specific medical problem and uses the results in the management of the beneficiary's specific medical problem. When one or more coverage requirements are met for colorectal cancer genetic screening. There is no other Medicare coverage for genetic testing as a screening service. When a treating physician orders the test as a diagnostic service and uses the results to manage the patient's condition. Next. What happens if Medicare denies genetic testing claims? Genetic tests billed to Medicare cost on an average between $9,000 and $11,000. If Medicare denies a claim, you could be responsible for the entire cost. Remember, these types of tests should only be ordered by your personal health provider who is familiar with your specific situation. Next. Here are a few things you could do to stop genetic testing fraud. The best way to avoid becoming a victim of genetic testing fraud and scams is to be sure that your doctor has assessed your health condition. Although Medicare covers many genetic tests for diagnostic use, it only covers one preventive genetic test to screen for cancer. Do not give your personal information to strangers. Review your MSN or EOB and report strange or suspicious items to Senior Medicare Patrol. Next. Now I will turn things over to Danielle, who will share the 3 keys to success in preventing fraud, errors, and abuse.
Good
Next.
morning, everyone. So next, please. So the first key is to prevent. Protecting your personal information is your best defense against healthcare fraud and abuse. Share your Medicare number only when necessary, such as at your doctor's office or pharmacy. Only carry your Medicare card when you know you will need to use it. Remember, Medicare will not call you to ask for your Medicare number for any reason. Keep records of all medical visits and procedures that take place and medical equipment that is ordered. Next, please. The second key is detect. Knowing how to spot suspicious activity can help you stop healthcare fraud and abuse in its tracks. Review your Medicare summary notice, also known as an MSN, or your explanation of benefits, also known as an EOB. Your Medicare summary notice is mailed to you by Medicare every 6 months now. They used to mail them every 3. Now they're only mailing them out twice a year. If you have a Medicare Advantage plan, you will receive an explanation of benefits after you receive any healthcare services. Compare your statements to your personal records and look for the following items: medical appointments you did not attend or were double billed for, or medical equipment such as braces, catheters, or diabetic supplies you did not order or receive. Next, please. The third and final key is report. If you suspect you've been a target of fraud, report it. This will help you and others at risk for healthcare scams. Here are some of the steps to report suspicious behavior. If you receive a suspicious call, don't give out any personal information. Report the call immediately to SMP. If you have questions about your Medicare statements, call your healthcare provider or your plan. If you aren't comfortable calling your provider or you aren't satisfied with the response, call SMP at our 877 hotline number shown on your screen. In addition to reporting fraud using our toll-free hotline number, you can visit our website at www.stopmedicarefraud.org and click on the orange Report Fraud button. Next. Please keep in mind that Senior Medicare Patrol is always looking for individuals to join our fight against Medicare fraud. Our volunteers receive training on the basics of Medicare and healthcare errors, fraud, abuse, and scams. In addition to giving presentations and attending community events, our volunteers participate in bi-monthly webinars and various training opportunities throughout the year. Volunteering for the SMP program is extremely flexible and is done on an as-needed basis. They determine how often they would like to participate. If you think volunteering for SMP is something you might be interested in, give us a call at our toll-free number and we can send a volunteer information packet and answer any questions you might have about the process. Want to stay up to date on the latest scams impacting older adults in your community? Just scan the QR code using the camera on your cell phone to be guided to our social media platforms, including Facebook for Georgia, Louisiana, Mississippi, and our Spanish Facebook pages, YouTube, and our podcast, Sip and Learn with SMP, on Spotify and Apple Podcast. Our state-specific SMP Facebook pages especially are a great resource for older adults and their care partners. To find out about hot scams happening as soon as we learn about them from reports called into us or from our community partners. Next. Together we can fight Medicare fraud. As mentioned in the previous slides, we have a toll-free number at 877-272-8720. You can call to report potential healthcare fraud or to ask us questions about potential fraud, and even to request we attend your event or speak to your group on our fraud prevention message. The SMP cannot be successful in fighting Medicare fraud without reports from people like yourself and invites allowing us to reach older and disabled adults in your community. Additionally, you can visit our website, www.stopmedicarefraud.org, for more information about the SMP program in your state. Our website can be viewed in multiple languages by adjusting the language tab at the top right part of the screen. Next.
All right, thank you, Sandra and Danielle, for the information on genetic testing, fraud, and scams and the SMP program. Coming up next month for Webinar Wednesdays, we're going to talk about how you can protect your loved ones from scams. So our topic for the month of May is going to cover caregivers and what caregivers can do to help their loved ones or anyone that they may be caring for to avoid becoming victims of fraud and scams. So the next webinar is scheduled for a week earlier due to Memorial Day. So we're going to meet on Wednesday, May the 20th at 10:30 Central, 11:30 Eastern. So just be on the lookout for the registration information for that. And now it is time for our prize drawing. So everyone who was registered to attend today prior to 10:15 has been entered for a chance to win, and you do have to be present. So give me just one moment and let me pull up the wheel. There we go. And open up the names of everyone who is here so I can see that as well. All right, let's go ahead and give it a spin and see who is going to win this month's Amazon e-gift card. Let's see, and I do not see Brandy on here. So let's go ahead and give it another shot. And unfortunately, I don't see Dinah here either. All right, let's go. All right, congratulations, Miss Portia. You are our winner today for our Webinar Wednesdays prize drawing. So I will reach out to you a little later on this morning to make sure I have the right information so we can get you your gift card. Thank you for attending and being here with us today. All right, let's just make sure we're back here with the slides. There we go. All right, so before we let everyone wrap up today and let everyone go, if you have a question you'd like to ask about today's presentation or the SMP program, please feel free to raise your hand and we'll unmute your line and you can ask. I'm also going to, let's see, Mr. Tom, I've unmuted your line. You just have to unmute your phone and you can ask your question.
Could this also apply to daily blood pressure monitoring offers?
It could. That kind of falls into the remote patient monitoring or telehealth. But yes, sir, some folks can find themselves signed up for that, you know, whether they intended to or not, and Medicare could be billed for that.
Thank you.
Yes, sir. That's a great question. And we actually cover that during our telehealth fraud talk module that we cover later this year. But that is a great question. Anybody else have a question? You can raise your hand or you can chat it if you like. Okay, well, I'm not seeing any hands raised, so I will be following up after today's presentation. So you'll have my email. If you think of something and have a question, please feel free to let us know. But this is going to conclude our presentation today on genetic testing, fraud, and scams. I'll send an email, again, a little thank you with a link to a short survey, and we would really appreciate it if you would complete the survey to let ACL know how we did today. Thank you again to Sandra and Danielle for presenting for us today, and we will see you again next month for Webinar Wednesdays with SMP. So everyone take care.